Our chief medical correspondent, Dr. Jon LaPook, is here. John, New York and New Jersey have talked about mandatory quarantine for people arriving from West Africa who've had contact with Ebola patients. But what about the rest of the country?
Well, the other states may decide to follow suit, but I just spoke to the CDC, and they're coming up with their own revised guidelines. And their concern is they want to be able to strike the right balance. On the one hand, they want to protect the general public, but on the other hand, they don't want to do anything to impede our ability to respond to the outbreak in West Africa. And for example, if you tell healthcare workers, well, when you come back, you're going to be quarantined for 21 days, they may say, you know what, I'm not going over.
Right. There's also this, people are still concerned as they read all of these things about how they may contract the disease. So what are doctors telling you to reassure them that it requires some contact with body fluids?
Well, I came across a study that I found very reassuring and that I'm telling people now. And it was about a previous outbreak of Ebola in Africa, same strain as the one now. And they looked at 78 household contacts of people with Ebola, people who lived in the same house as somebody with Ebola, but they didn't touch them. And of the 78 people, nobody came down with Ebola. They were living in the same house. So for the person who's worried they're going to touch the subway seat next to them and pick it up, this should be very reassuring.
So you need contact with human body fluids.
Yes.
Thank you, John. We'll have the latest on Ebola this Sunday on Face the Nation. I'll be sitting in for Bob Schieffer, and our guests will include Dr. Anthony Fauci of the National Institutes of Health.